Hi, guys, and welcome. Hi, Yasmin. Thank you so much for joining me.
Thank you so much for having me on board. It's an absolute honor to be here.
Awesome. Guys, today we are talking about the informed gut. And I think you guys will all know this feeling where we're kind of sitting between, do we want to focus on the evidence and do we want to focus on the science and what, the anatomy and the nitty-gritty of the theory, or do we want to lean a little bit into our intuition? And sometimes those two things can be very conflicting. I find that they have very different thought processes and very different brain spaces, and so they can really become conflicting, but they can also be really good together. So I'm very excited to be talking to Yasmin about that today and kind of finding where we are in that space between these two, what feel like two very different worlds. So we are here to have a conversation with you guys. Please ask questions or share your experiences. We really do want to hear from you. Let us know where you're joining us from and your experience with today's topic. We would love to hear from you guys. So Yasmin, can you please introduce yourself and let us know why this topic is really interesting to you?
Yeah, absolutely. So I'm an equine physiotherapist. First and foremost, that would probably be the more boring side of the title, if there is a boring side. I love the subject, but there are so many areas for digression within even that topic, and I think that's really fun. Now, within my practice, I found myself more recently stumbling. I don't want to do a disservice to my practice by saying this, but stumbling more around the philosophical side of practice. And what I mean by this, particularly in the equine industry, is really starting to understand why people are motivated to do what they do, or why they are motivated for the results that they want with their horse, whatever that means. And I don't mean performance-based results. I mean, that can be down to relationship-based goals, that can be down towards their management preferences. But really starting to understand that of not only my client base, but also to help my client base to understand that of themselves so that they can help themselves to help their horses better. And I happened into that avenue because I found that a lot of horses that I've worked with, certainly in the past, and now with kind of how I platform myself, I think that's starting to change. But I've seen a lot of horses kind of happen into problems because of industry pressures. And those industry pressures maybe overtly are because of their signaling within the industry. But then on a more subliminal level, there's the signaling in the industry, but then there's how that signaling resonates for the person who has the horse. And so in being able to understand that can help me to help people and their horses better, because we can kind of cut through the noise and say, well, these goals that you have, which for this horse in this moment in time might not be fair, reasonable, or possible. How can we break these down so you still feel like you're achieving something with your horse? You're still heading towards your goal, but your horse isn't perhaps falling by the wayside because of these goals. And then by proxy of that, you're not feeling frustrated because you're not achieving the goals that your horse can't currently achieve. And I think that came about definitely through my own journey. And that's been more of a personal journey rather than directly with the horses, albeit I don't think you can have a personal psychological journey without that influencing how you show up with your horse or with other relationships in your life. But in kind of having probably, if I'm being brutal, enough therapy to sink a battleship over the course of my life for varying reasons. Some of it being because I'm naturally very introspective. So I have a thought and I go, oh, I'd like to boil down more into that one. And then going through the therapy route to understand that more, as well as, life is lifey for everyone. But then within that, in pulling that introspection thread, it's helped me to kind of catch myself a lot on my own personal narrative, which has helped me to help my own personal horses better. But then I also believe that that has helped me to help my clients better, or even signpost my clients in directions that perhaps they didn't foresee, but have helped them to help their horse. I hope that's answered the question for you.
I love that, because it really brings up this feeling of curiosity for me. So the way that you're approaching your clients is with this, or at least that's what I'm hearing, with this feeling of curiosity and really trying to understand who they are and what they're bringing to the table, which is incredibly important if we're going to find the way to work towards, like you say, achieving their goals. But it's deeper than that, right? It's like, if we're talking about owner compliance and positive outcomes, it's 100% dependent on if we are actually hearing and understanding what the needs are of that human being within that relationship with their horse and within that space. So I really love that. Thank you.
Yeah. The curiosity piece, I think that's a big one. I think from a therapist perspective, it can be easy to be quite detached. So I had a client not too long ago say to me, you look at my horse and you say, that's interesting. And I find that really worrying that you do that, because interesting doesn't necessarily mean good. And it was a very helpful thing for them to say, because it kind of caught me on that. But it can be very easy with someone's horse to be objective and not see that there is an individual attached to that horse who thinks the world of that horse. And I might notice something which, on the scale of, if we were to put it into big sick and little sick, probably doesn't even register on the scale. But to them, you're plucking out something anomalous, which feels really scary. And so just coming back to the curiosity piece, I try to maintain curiosity with my clients, but also with myself, because I think that also helps us to navigate life when it gets tricky. With respect to our horses, maybe having a curiosity mindset helps us to explore these avenues that we wouldn't necessarily consider, because I think, as a lot of us know, it's not black or white. There's a whole myriad of influences on our horse, but then with that, there's a whole myriad of options that we could explore. Yeah. We've also got to keep a lid on that box to an extent. We don't want to be all across the map with our options. I also think that options are powerful for everyone, because if something doesn't work within a reasonable time frame to give it time for it to work, you've also got somewhere else to go, providing you have the curiosity to explore it.
I like that. Thank you. Okay, so coming back to kind of this evidence-based versus intuition, let's define those a little bit. So what does evidence-based practice mean to you as an equine physiotherapist, and what does the clinical intuition mean to you, and what does that feel like?
This, I think I'm going to come in at this one laterally. I like that we're, nearly 9 minutes in and I'm already on a side quest, but bear with me. When we look at evidence-based practice, I think it was coined in the 70s or the 80s, the 3 pillars of evidence-based practice. And it was coined, if I'm right in remembering this, in the medical field initially. And the idea around this was actually to prevent people from basically running away with their own biases. So the 3 pillars are looking at the best available research on a subject area. Then it's looking at the client or patient preference around that, would be pillar 2. And then the 3rd pillar would be the professional's lived experience as well. So if we're looking at evidence basis from this lens, and again, it was from the 70s or the 80s, we're breaking it down into 3 pillars that empower us via research They empower our patients via their own preferences. Now, when we're looking at this with horses, we're looking at the human involved, but we're also looking at the horse too, which I think is really important. And then we're also looking at how we show up as professionals as well. And I'm all for individual professional empowerment, particularly because I think in the therapy sphere, there are a whole host of professionals with different titles who all have their different clinical experiences that they can bring to the table. And I don't know necessarily about the legislation in South Africa, but I know that in England, the buck stops with the vets, essentially, which means that we can create conflict between what the owner wants, what the therapist thinks, and also the veterinaries or the veterinary professionals' experience as well. So around that, when I'm looking at best available evidence basis, I think we all have a lot of resources available to us as professionals, which enable us to keep up with the research that's out there, whether that's via webinars, whether that's via platforms such as yourselves, platforming industry experts who are on the sort of, it's like forefront, if you like, of research that is coming out. And whether that is also looking at white papers, whether that's looking at peer-reviewed things online as well, as a modality to achieve that. But then also, whenever we're looking at research that's out there, that research was founded upon an idea that someone had. And that idea that that person had was likely founded upon a thought or feeling that they had within their own professional practice, and they looked to explore it. And what we also know with research is that, we're always reevaluating that research. When we understand a subject area more, we can develop on that research. But that does also mean that in 5, 10, 15 years' time, that research might be disproven or it might be elaborated on. And so keeping a healthy level of, not skepticism, that's the wrong word. I think keeping a healthy level of still sticking a head above the parapet and saying, okay, but what else is there feeding into the picture within this clinical trial? Or also within this horse, which may make this horse anomalous to what this research found as well.
I really like that. I'd like to actually go a little bit more into just that evidence-based practice, as we labeled it, because there's so much more to it. I love that you've given those 3 pillars. I did not know that. I would have defined it as evidence-based practice is the course of action that is the best in accordance with the research that we have. So for this condition or this patient population, we have this research, and it indicates that this is the best pathway to take, which is very limited in our industry. We have very, very limited real evidence base, like a real evidence base to drive our clinical decisions in our practice. And I also love that you kind of brought that skepticism is the wrong word, but we can so easily say we're evidence-based practitioners, and then we put our blinkers on and we just do what the evidence says. And that isn't right, because the patient populations so rarely reflect the patient that's in front of you. There are always limitations to evidence. Like if you really go and you read papers with a critical perspective, it's so rare that you can say, hey, I can actually take these results and apply it to this patient just like that. You have to add another layer of clinical reasoning to that. And so I love that that 3rd pillar is the practitioner experience, because that fills in a lot of gap. And to me, that kind of comes in with mentorship, your training, your experience, the team that you have around you. All of those things impact the clinical decisions you'll make at the end of the day. And then I would never actually have thought of patient preference as a pillar of evidence-based practice. I like that you brought that in. Thank you.
And I think especially with that pillar in particular, I know probably one of the most challenging things in any therapist's career is doing right by the horse and the human all at once. And I think we can be, particularly because we have bills to pay, right? You know, we all want to do this for the love of it, but also we need to keep the human on board in order to keep the business sustainable, to keep on keeping on with helping the animals, as well as keeping a roof over our head. But also, if we look at research, there's been so much done now into ethograms, into horse behavior, into ethology in general, which means that we can now start to see preferences. We can start to see what a horse appreciates versus what they don't appreciate. And I think that's a really big thing that can often be overlooked, particularly in the rehabilitation sphere. We have a veterinary diagnosis of some description, and we know that we perhaps have a series of exercises that we can do with that horse to target that injury, but also that horse is its own sentient being with its own lived experience, and in that moment that horse might be too painful to do the exercises that we want them to do on a very sort of overt level. Or if we're working with a horse that is traumatized, for example, it might be that it's not appropriate to be working the horse in that way in that moment in time. But we end up with conflict because we have a veterinary diagnosis, and therefore we have the perception of suffering as well. And then within that, we have the owner who feels terrible that their horse is having a hard time, and, you know, in the very least, they want their horse to feel better, but also they perhaps want to be back out doing things with their horse. And then at the same time, we're looking at this horse and saying, well, you know, this horse is having a pretty hard time right now. How can we accommodate for that? And I think this is where we can get the interplay between the evidence basis, you know, pillar one, research, and then also pillar two, client perception, and the client being the horse as well as the human. And then, you know, this, I think, is that empowerment piece where we can objectively look and say, how does my horse feel about that? Very occasionally, I happen across horses who are perhaps living in such chronic stress that they don't appear to have any preferences. But then I also find the power in that is giving the human involved homework to say, right, let's go find out about your horse. We're going to make this a fact-finding mission. Tell me what your horse loves. And not only that, tell me what your horse loves and tell me how you know. Give me visual indicators. Let's start to develop a library within your time with your horse so you can start to communicate better with your horse.
Okay, I love that. I wanted to add, you mentioned that the research, like the evidence-based practice, is going to protect from biases from the practitioner. I completely agree. That is a great purpose. And I also think it serves the purpose of protection of the patient, right? We're not doing weird things with patients. And I mean that in a negative sense. We're not experimenting or trying different treatment pathways that could be dangerous or damaging or harmful, because we are trying to adhere to the best standards of practice and what the evidence is indicating. And I think, like, within the medical profession, that's super important. And then it's also applicable and important to us. So I like that. So let's go to the other side of the coin, which is intuition. What does that mean to you? What does that look like? How would you define that?
This is a good one, because I think that your intuitive scope changes throughout your practice. And I think it changes by proxy of what you feed it. So when you're looking at, I'm going to bring us back round to research. I think research can help inform our clinical decision making. Absolutely. And then when I have anyone that works with me on a mentorship perspective, I'm always telling them palpate. Like, palpation is your friend. I understand that palpation is inherently subjective because we all do it differently. Horses respond to different people in different ways and blah, blah, blah. But equally, you can bring up your own case file of palpation, which resonates best with you. And I will then apply this. I mean, I'm using palpation as just one tiny example, so bear with me here. But if I'm presented with a horse that has got a set of diagnoses, I will palpate that horse because I want to know this horse who looks like this, with this postural profile, with this gait profile, and this diagnosis, this is how they feel. And then with that, I can correlate how they feel, how they look, and their diagnoses. Now, obviously, correlation and causation, aren't mutually exclusive. But then this helps me to put together a series of pictures or a library in my head, much like our human with their library for how their horse feels at any given moment. For me, I can start to look at a horse and create a series of patterns, if you like. There's pattern recognition within that. This horse feels like this. This horse had this diagnosis. These are the problems that this human had with this horse. And this is how it correlates with other horses that have presented similarly in the past. Equally, within that, so that sort of intuition sense means that I can look at a horse and suspect, oh, maybe this horse is a candidate for kissing spines, and maybe this needs to be a vet referral. And so we start to get a little bit beyond lameness and we start to really train our eyes. What is it that we're looking at? What is it that we're seeing? And then over time, with repetition of this, I was chatting with someone the other day and I just literally glanced at their horse and thought, oh, that's looking better. And I was looking at their wither profile and I thought, oh, we've got more, we're more neutral in that regard. That's great. And immediately my brain saw the horse, didn't even register I was looking at a horse, and immediately saw a pattern and attached a label to it, if you like. And so I think this is where we can start to build on our intuition. Then in and around that, if you're presented with a pattern that sort of looks like this, but then is sort of anomalous, you can start to build that curiosity piece of, okay, what might this mean? But it also means that you can open up the line of discussion with the people involved and say, this is what I'm seeing. This is what I'm seeing relative to other pictures in the past. However, this is outside of that because of these variables, or even being able to say, this is what I'm seeing. I've palpated. It doesn't feel too scary to me or too restricted, or, insert any clinical terminology there. However, I just wanted to let you know this is what I'm seeing and feeling, and therefore we can work together and make a decision based off of that. And then kind of building from there. And then I think it's that curiosity piece again. We're circling around that word quite a lot today, of this is what I'm seeing, having the conversations with the client, and then also giving the power back to them and saying, what would you like to do about it? And then that can be led by the client's values as well, providing we haven't got any big welfare concerns going on here. So that might be a client might choose a more holistic intervention over a veterinary intervention. And the beauty of that is I can say, okay, well, we're going to put a time frame on this because this is your horse's well-being on the line here. But then I also get to observe what happens as a result of that. And that builds in with that intuitive piece as well. And I think that's really important, that you can continue to extend the scope of that, of building your intuition, and that intuition is based upon previous experiences. Of course, I do think there's an energetic element to that, which is really difficult to quantify. But I feel, and maybe this is based upon my own experience, that the energetic element often comes hand in hand with pattern recognition anyway. So then is it energetics, or is it the fact that you have sensitized yourself to recognize the subtlest signs? I don't know. I'd be interested to know your thoughts.
Okay, I do want to actually share my thoughts. I rarely do because I'm actually here to, learn from you. But had you asked me that question of how I would define intuition, I wouldn't have described you kind of spoke about the pattern recognition and your experience that feeds into and builds this library, which then helps, like, essentially you're creating connections through your experiences, right? When you are seeing this, you're also seeing that. And if you see this, could you potentially be seeing that? That's kind of the idea that I'm getting. So it still feels to me like a clinical or even an evidence-based thinking process. Whereas if I had to define intuition, I would say it's feel. It's when you switch that part of your brain off and you stop looking for patterns and you stop looking for, like, you take the little objective boxes away and you switch off the checklist and you switch off the process, and then you just allow yourself to feel and respond to the animal that's in front of you. That's how I would have defined that. And I'm not very good at just like switching all of that off and then just being present with the animal in front of me. And I find it very difficult because am I failing them because I'm not doing my job like that correctly, right? I would love to hear from our listeners. How would you define, like, what does that mean to you? What does intuition mean to you, and how do you define that? But what I did find really interesting from how you chose to describe that is that I agree that what you feed it, like your intuition is very dependent on what you're feeding it. And that it comes secondary. So like we're trained first in the science, in the anatomy, in the biomechanics, like you go really deep into the theory. And then once that is second nature, you can switch it off and let it go and then follow the feel. But because that foundation's already there, it's not gone. It's it's feeding into that feel and it's driving it, and it's you add different knowledge, different theory, and your feel changes and goes somewhere else. So I think that's super interesting. And yes, how do you define that energetic feel? What do you say?
This I love this so much, because the phrase that I'm going to pull from what you just said is, I'm going to shut my brain off and I'm going to see what the horse tells me.
Yeah.
But how do you, and I'm throwing the cat amongst the pigeons here, perhaps, how do you see what the horse tells you if you don't know what you're looking at? And I understand within that, if we go very much into the feeling energetic space, I've been in situations where I've felt sensations in my own body, or I have received words or pictures, and that could be, some sort of neurological glitch in my own system, but I choose to not believe that because I don't think it is. But then at the same time, when we are really feeling what the horse has to say, I think there is a visual element within the feeling. I think there's a frequency piece, there's a vibrational piece, there's you can walk into a room with someone and you can feel the energy they give off. That might be, oh, this is wonderful, or that might be, okay, tread carefully here, we're not very safe. But I think that there will be visual indicators which go with that. And then I think if we're looking at pattern recognition, we're able to perhaps piece together the visual indicators with those energetic indicators and then pick up on the energetic indicators further down the line as we enhance our library of sensory information to help, to help us do our job. Does that answer that? I don't know whether I've just opened Pandora's box here.
I think you've gone to a whole nother space where I haven't been. So it's difficult. Like I'm gonna try and connect to that. So I have definitely felt or kind of tried to say, okay, if I'm here, I'm positioning myself here, I'm trying to connect with the space. So let's, like, my hand is on your pole or on C3, and then if I'm checking in with my own body, what am I feeling? Where is that going? And I do think it's so important to switch off your brain and to just feel, because otherwise I'm analyzing all the time. I'm thinking about where I am and what I'm feeling and what grade and how much tension and is it this and is it that, and what is the owner thinking, and do they think I'm weird? So you have to switch it off and stop, or I have to switch it off and stop thinking and then just feel. And I have definitely felt like if I check in with my own body, is there a pattern of tension or pain that isn't mine? I've had that, but very rarely, because it isn't actually a space that I go to very often, this like intuition based movement. I will generally only do it if I'm stuck. If my normal like clinical process and clinical reasoning has not yielded the results I want, or I don't feel like the patient is responding, then I might change my approach and say, well, that's not working. So let's everyone just be quiet. I can't do it with the owner though, to be honest with you. You've created this really curious conversation with your client. At least this is how I'm picturing it. And I find that very distracting and very like a block. That means I can't really connect in that way with the horse, because they're talking to me and I'm paying attention to them, and then I can't focus, right? How do you does that sound right?
Yeah, that's a brilliant one. And I think having a curious conversation with the client and opening the client up to a more curiosity-based mindset is an enormous help, because you can then explain. When I'm working with a horse, I try to explain everything as I'm going on as much as I can. And I will also say, I'm really sorry, I'm focusing on my assessment right now. So just bear with me, because sometimes I can't feel and talk. And then that's a nice way of creating a little buffer around the experience, so that I can give them what's available to them based upon my own skill set. That being said, I think it waxes and wanes. So with some clients, when you can feel you can feel their intention, and you can feel that they very definitely want something out of you. And for me, if someone wants something from me, that immediately makes me want to sort of brace, and it makes me want to get a bit, not forceful with the horse, but like, come on, find a thing, help them. And I've certainly in the past few years become a lot better at that, because all I have to offer is what I have to offer. So that really helps. And if I don't answer the human's questions, well, then hopefully I can send them in a direction, whether that's a referral to a different professional, or further reading or resources online, to help them pull that thread themselves. So I will also try to be quite candid with the client and say, I'm not sure whether I can answer that for you, but if I can signpost you in a direction, then I will. Much like if I lay my hands on a horse and I think there is something very wrong here and I don't know what it is, and there's nothing in my library of clinical recognition that I can pull on, but I know there's something not quite right. This is why I think there's something not quite right. And I'll say, I don't know what it is, but I'll support you in finding the answer. Then that's also something that I will do. I also think it's really important from a professional perspective to be able to vocalize the intuition that you're feeling. So I will say that it's very rare that I get something intuitive drop in that doesn't also have concurrent visual indicators. And I think that's important if we're making any clinical judgments, to be able to evidence that with why. So we're not just going off of vibes, and we're also not, as you said earlier, experimenting on people's horses. I think that's really important, because I think we haven't touched on bias yet, although I'm sure it's going to come. I think it's really important from our own personal biases that we're not doing things because we think that there is some sort of underlying God complex going on there. I think that's very important. But to circle back round with your client, I will start to chain things together as I'm palpating. And if they ask me a question, I'll say, while I'm in the midst of palpating, I'll say, just give me a minute, because once we've drawn all of this together, I might be able to answer that question better for you. Just to buy yourself some time as well, and also manage their expectations too, in that we can't just sort of look at a horse and magic a response. There's a lot more thought and feeling that goes into it.
I love that. Thank you. Do they feel like opposite sides of a coin to you, like the kind of clinical reasoning and evidence-based versus intuition, or feel, or you mentioned energetic work? So like that would be how I would find that. So do they feel like a little bit opposites to you, or do they feel like you're doing both things? You're not leaning one way or the other, or having to choose between them? Because I think that would be the sweet spot. If we could do that, we could tap into both of those things. That would be great. But to me, they feel in opposition most of the time.
I think they're in opposition I think they look in opposition, or they appear in opposition to a lot of people when you put them on paper. Even if you look at evidence-based or research-led versus intuition, I bet those two phrases bring up different emotions in your body. For me, research-led feels clinical. But then also, if I look at intuition, that might feel a bit, I hate the word waffy, but it might feel a bit fluffy or waffy. Whereas I think that is kind of born out of people's misunderstanding of what intuition might be to them. And I also think, certainly when I look at evidence basis, if we look at prescriptive exercise as an example, I see it more through a lens of appropriate versus inappropriate, and why. So, for example, if we're looking at making decisions for an exercise program for a horse, well, I know that research depicts that based off of this pathology, these exercises are indicated. However, with the horse's current physiological and emotional or behavioral presentation, these exercises aren't indicated. So the research is there and it's valid, but it's not appropriate at this moment in time. And then I can speak to that and say to any professional, I can speak to the vet and I can say, well, I understand your modus operandi. I know why you want to prescribe this. However, we can't do a pole work exercise with this horse 4 times a week because we currently can't get this horse in the arena without them having a mental breakdown. So we have on the lesser end of the spectrum, outcome orientated things that we can't achieve, which is demotivating. But we also have a very big safety issue going on for the human involved and the horse. And then we also have a welfare issue involved because of this horse's response to the required work. So that's kind of my scope of that. And I do find for a lot of people, they have this internal moral compass or moral ethical compass where someone tells them to do something and they say, oh, that doesn't feel quite right. And I can't put my finger on it, but I know it doesn't feel quite right. And then if you can help to explain to them the things that are into play within their horse's presentation, which perhaps confirm their bias that it's not quite right, but also validate them and also help them to see that, well, they were on the right tracks, even though they didn't have a dialogue for what they were feeling. I think that also kind of brings intuition into more of an evidence-based sphere as well. And if we're looking at evidence basis, I do think that as much as research is lacking, there is also a lot of evidence to counter the evidence. So, for example, pole work is indicated, yes, but that horse is featuring quite high on the horse grimace scale. So can we maybe deal with that first and then circle back round to pole work as well?
I love that you're bringing in those the ethograms, the ridden horse ethograms, and the grimace scales, because I think it's fantastic that we have those now, and that we can bring in these measurable things that before felt like wishy-washy, because our biases as equestrians are your horse is being naughty, or you need to be firm, or you need to have boundaries, or etc., when actually they're just behavior, and we need to treat them with curiosity and recognition for what they are. So I think that that's very helpful. I love that you brought that in. Thank you.
Pleasure.
And that's an example actually of like where something that felt like intuition, right? Reading your horse and understanding what they're saying or what their body language means feels like intuition or wishy-washy, has an evidence-based back that we can lean into and that can feed into that. So it's kind of like, what comes first, that intuition or the understanding and the knowledge, and how do we bring them together so that they're complementing each other, building each other up?
Yeah. And I think ultimately with that one, I think this is where we get to professional discretion, really. I know that I have my own sort of moral compass within my practice, which means there are specific things I won't do with a horse, or I won't advocate for, because I quite frankly won't be able to sleep at night. And that, that extends beyond how I show up with a horse and is more what I'm also willing to condone within the horse and human partnership. And that is also dependent on how on board I think the human is, and how on board I think I can help them to become, to help them help their horse. So I think that's a tricky line to toe, and I think that is dependent on each professional, their lived experience and what they feel is okay. And I think that changes over the scope of time. So what I try to do with everything is I do try to look at the research available, and I try to qualify points within reason, whilst also allowing for flexibility, and also looking at the research and saying, fundamentally, do I agree with that research within my moral compass? I think this is interesting when we look at perhaps different training methodologies within the horse sphere. There are a lot of different schools for training. There are lots of different ways in which we can achieve things. And then with that, I'm laughing because I think I'll use my intuition, because I'll look at the horses within that training sphere and I will see how that horse looks within that training program. Now, of course, that's intuition in that I can look at that and immediately get like a gut feel of, oh, that looks lovely and that horse is having a nice time. And then I'll think, okay, why do I think that's lovely? Why do I think that horse is having a nice time? What indicators can I see? And the same rules apply for if I look at something and go, oh, goodness me, that horse is having a terrible time. It might be because someone's wielding a big stick and that's outside of my moral compass, but it might be that I'm looking on that horse's face and thinking, we look a bit too grimacy for that to be a focus face going on right now. So that's going to make me ask questions as to why that horse looks like that in that training program. Does that make sense?
Yeah. I think
too much of a digression.
No, you've just opened a whole nother topic for us to explore, which is creating professional boundaries around your moral compass. And what does that look like? I can think of so many things that need to be explored there. It's huge. But I am going to start wrapping us up. So, Yasmin, can you tell us where the listeners can learn a little bit more from you?
Absolutely. My absolute passion project is my weekly email, Modern Centaurian, which can be signed up to via my website, www.yasminstuart@equinephysio.com. There should be a pop-up. If not, scroll to the bottom of the page. You can input your email there. Within that, each week, I share either a conversation that I've had with a fun professional who I think really highly of. I also share bodywork techniques or training techniques or enrichment strategies to help you help your horse, but also to help you to build a dialogue or a narrative or a library around what it is that you're seeing when you are with your horse, so that you can help yourself to help your horse better. I also share books I've been reading. Some of them are horsey, many of them are not, because I think this helps us to extend our own scope of understanding about ourselves, as well as any podcasts I've listened to. There's a journal prompt to prompt introspection, and there's also a quote of the week, because I love that sort of philosophical thing as well, anything to get those curiosity juices flowing. I'm also on social media, Yasmin Stuart Equine Physio on Facebook and Instagram. And I also have an online course which is being relaunched in October. You can sign up now, but the material is changing in October, called The Fundamentals of Horse Posture, which is really encapsulating everything that I talked about at the beginning of this call with regard to what it is I'm seeing, what it is I'm feeling, bodywork techniques to support that, as well as perhaps some movement strategies to support that. But it's not going to be prescriptive, like you see this, do X, Y, Z. It's also going to help people to really start to see their horse, to make really good choices for them.
Awesome. Thank you so much. I am on your mailing list and I love it. It's one of the emails I look forward to the most every week. And I think it's because really that introspection part is not something I spend a lot of time doing or that I'm super good at. So while I would love to journal and keep putting it on my, like, do this to become a better person, I never actually do it. So thank you, Yasmin, for that, because I do find the prompts really helpful and insightful and lovely. So yes, guys, sign up to that mailing list. You'll enjoy it. And we look forward to seeing more of you guys online. I do want to remind you that today is the last day to purchase early bird tickets to the Vet Rehab Summit. So at midnight tonight, it switches over. That's a whole $100 more. So now is the moment to buy your Vet Rehab Summit tickets. There are free registrations available, but the free registration, you will only be able to join us live on the day for the event, which is fantastic, and I highly recommend. But if you want to watch the recordings or earn CPD from that, so download the CPD certificate, then you need to either be an online pet health member or you need to purchase a ticket. Of the two options, becoming a member is far more cost effective, far more value. I, again, highly recommend just becoming a member because it's the easiest way to really do anything with us at Online Pet Health. But that's it for today, guys. Thank you so much for joining us. Yasmin, thank you so much for sharing that knowledge and just having a conversation. I loved it.
Thank you so much. I loved it too. Have a great rest of your day.
Bye, guys.